Hey guys, welcome to this week's podcast episode, and I've got a fantastic guest for you today, Dr. Gwen, and she is an expert in common mental health diagnosis in young children, and it's going to be a great conversation about female entrepreneurship, self-care, young children, mental health, and so many important topics and issues with in today's talk, and I'm happy to welcome Dr. Gwen to the show. Gwen, welcome.
Thank you so much for having me.
I know we were kind of exchanging backstage and, um, you know, discuss your journey and how you got started and how you're doing what you're doing.
So, my journey started, I actually started out as a special education teacher, and then I transitioned into a school counselor. I was a school counselor about 20 years or so. During that time, also worked in clinical mental health. And 2 years ago, I took the entrepreneurial leap into private practice. So I tell people I'm a 25 plus year educator turned entrepreneur. So currently I have a private practice here in Savannah where I primarily work with adolescents and teens.
Yeah, well, I love that, and there are so many different topics we can talk about your entrepreneurial journey, and as well as a lot of the mental health issues that we're seeing a lot today. So for a lot of the audience, they have children, and especially in today's day and age, we've got social media, and now we've got artificial intelligence, which may cause a lot of disinformation. We also have a highly polarized world, and we've still got so much violence and war. So kind of talk about common mental health diagnoses that you're seeing in young children today.
One of the diagnoses that I work with kids often in is anxiety and depression. And a lot of that goes along with what you just said. A lot of what's going on in the world right now, take just the pandemic with COVID the last couple of years, kids are still recovering from that. Like it still has a major impact on kids around anxiety and depression. And what I tell people is I think in a lot of instances, kids were doing a good job of managing some of that anxiety and stress pre-pandemic, and then the pandemic hit, and the ones that were just surviving, not really thriving, the pandemic kind of threw them for a loop. And especially even the social anxiety and interacting with peers and that kind of thing, like there really still a lot of challenges around that.
Yeah. Yeah, I can remember because I'm a Gen X millennial, and I can just remember as a kid growing up, the worrisome thing that I had was getting into college, but kind of you could leave your door open, and like you could like what you worried about was like when was the ice cream truck coming, and now you got to worry about somebody shooting at your kids, and like or just all this like random nonsense. I love this idea of self-care for kids and practical ways to promote mental health, how to protect our children from just this really disastrous world.
And I say often, a lot of the kids that come to me are super bright. They're like really bright kids, academically and everything else. But I think a lot of their challenges is dealing with that, like you just touched on, like going to college. For a lot of kids, I think they are the ones that kind of fall through the cracks in regards to mental health because they aren't the kids that are making, or wreaking havoc. Like, they say the squeaky wheel gets the oil kind of thing. Like these are well-behaved kids. So in class, I think they kind of like fly under the radar and fall through the cracks because they aren't the ones that's acting out or saying anything. They're the quote unquote good kids, but these kids are struggling mentally and emotionally. So like some kids can tell me exactly how many words they maybe said during a day. And for the teacher, it's like, this kid is great. They don't talk. They don't talk because of their anxiety and they can't find the words to say. It's not because they're, just being compliant and all of that. So sometimes it's giving kids coping strategies. So a lot of them that come to me that deal with a lot of anxiety, I think the first line of defense sometimes is just to automatically put kids on medication to help with the symptomology, but it's that helps with the symptoms, but it still doesn't give them tools to cope with. So when they come to me, I kind of help them build their toolbox of ways to actually cope, and actually someone that's listening to them and figuring out exactly what's causing the anxiety, and then we work from there, or even the depression, whatever the issue is that their presenting problem is.
Yeah, and what's interesting is you mentioned, I love this idea of toolbox and the emotional toolbox and coping skills. So what are, I mean, you'll have to, because of course, parents bring their kids to you. What are some, very bread and butter ways of coping and dealing with, stressors and managing anxiety and all of that?
A lot of it goes back to basics, just some of that, executive functioning kinds of things with time management and organization and all of those things. It's amazing, like when we do some of the assessments like the GAD or the PHQ, which it measures anxiety and depression and those kinds of things. It's amazing that one of the things kids are not doing is sleeping, especially the kids that are really worried about their academics. I mean, I have kids that'll say, I set my alarm clock for 4 o'clock in the morning when they've just gone to bed at 11 at night, because they're involved in sports and all these extracurricular activities, yet they have to keep up with the academics. And so they're getting up at 3 or 4 o'clock in the morning to do homework before school. And it's like, that's just not sustainable. So sometimes just helping them come up with a schedule, like to manage their time, helping them learn the importance of getting a good night rest and getting, sleep, asking for help. Like sometimes, especially when you have strong parents or parents who are not necessarily readily available. Either they're very professional parents, and so you feel like they're always busy, and they seemingly always have it together. So the kids don't always feel like they can tell their parents that they're having these issues, because they think the expectation is that my parents seem to do it all, I'm expected to do it all too, kind of without complaint. Or the other side of that, you have parents that are working multiple jobs that aren't available. And so the kids just feel like they have to find a way to do it. And it's very stressful. So just teaching them simple strategies like the, 5, 4, 3, 2, 1 strategy, or teaching them different breathing techniques, or like I said, asking for help. Like that's one of the primary things, is to reach out and ask for help when you feel like I don't have it all together. I don't know how to do this.
Yeah. Yeah, there's so much to unpack there because, raising a kid and there's so many people come to you with different issues, ultimately the underlying sign is anxiety or depression, but there's a lot of pathways that are causing that, either family or school or different things. So I love these ideas, how you do, kind of these executive functioning, breathing techniques as well. So the other question is, so talk about this. You've actually done different transitions, and how can the audience out there, they're considering, okay, they're a former, accountant or lawyer or doctor, and they want to do something more significant and have more impact. What advice would you give to those people looking to do other things and transition careers?
To follow your passion. To follow your passion. I think one of the things that I've said is that sometimes in the job, because I actually love what I was doing, I love working with kids, I love being in the school setting, but also I think that sometimes complacency impedes progression. I say I was really good at what I was doing. I enjoyed it, but at some point I felt like I just wasn't continuing to grow as a profession or within the profession. And I didn't feel like, I don't know, I didn't get the same gratification that I did at some point. Like I wanted to expand. And that's what opening the practice has allowed me to do, is that I still get to work with kids, I still get to work with families, I still get to work with schools, but I've broadened my reach. So I'm reaching more people than just within the school building. Now I have a reach for the community. So one of my mottos is faith over fear. I think sometimes we want to do things, but that fear of the unknown kind of keeps us from taking that leap. And one of the things I've done, because like I said, going from educator to entrepreneur was a huge paradigm shift. Like I don't have a background in business at all. And so just taking that leap of faith and opening a business, asking questions like I just talked about before, finding support, a mentor, attending classes, meetings, networking, uh, getting different certificates. So it's like I have to pour a lot into the business to make that transition and to continue to be successful in the business. I'm learning every day, continuing to learn and grow. So I think you have to be open to that when you're making a transition, just making some of those connections.
Yeah. A lot of people listening to this, they're on the fence and they may feel like, okay, their passion is X and they're formerly doing Y, and then they say they make that transition and they're afraid of, people saying, "Oh, what happened to Y? You were doing this and why are you doing this now?" What do you have to say for people thinking along these lines?
Well, I can say like when I got ready to leave the school, when I first told some of my colleagues or even some of my family members that I was going to make this transition, it was like you're not leaving the school. This is what you do. Like you've been. I'm like, no, really, I'm leaving, kind of thing. And I think one of the things is not feeling like you have to have all the answers or everything in place, because I think if you do that, you'll never make the transition. If you feel like everything has to be perfectly aligned and I say do it. When I first started to practice, they were like, well, where are your clients are going to come from? And I'm like, I'm going to figure it out. I am going to figure it out. I don't have all the answers now. They're like, well, you're leaving and you don't even know how you're going to make money. I don't have the answers, but I am going to make this happen. And I think if you like are really serious about it, and it is a lot of work, like I won't like try to minimize it. Like people think, oh, well, now I'm going from this 40 or 50 or whatever hour a week job, and I have my own hours, and it's a lot. I'm not saying it's easy, but it is doable.
Yeah. And the other common theme that I encounter with people doing multiple things, the younger generation, like they get it, they understand that a career is going to be a portfolio career. And the common thing I hear about is these skill sets that prepare you for the next thing. So elaborate on this idea that, what you learned in your previous careers helped you to be doing what you're doing now.
Absolutely. I think being a teacher made me a better counselor. Being a counselor made me a better educational leader. All of those skills I bring with me into the practice. But going back to the kids, one of my concerns as a practitioner and especially someone that's working with kids is the whole social piece. Like a lot of jobs now, and with kids, before in my day, I will say everybody wanted to be, a basketball player, that was going to be their thing, something in sports. For the kids now, it's like, oh, well, I don't have to interact with people. I'm going to be doing animation or I'm just going to do whatever on the computer. I'm like, yes, but you still have to know how to hold a conversation and interact with people if you're going to have a business and all of this. And they don't always see that. And that's an area where they really struggle. I think as an educator, when the pandemic hit, one of the things is people always say, well, kids are great on the computer. They can do this, that, and other, and they start at such a young age. And they use it for enjoyment. But when it comes to using the computer to gain knowledge and for academics and all of those kinds of things, I think they struggle in that area. Like it was sending a text, well, not a text, like an email. They didn't know how to send an email, but they can do all of this other stuff on the computer or writing a paper. Well, of course, with AI, they have a lot of support in that, but still, you still have to have the basics foundation of, and I think for kids, like sometimes that's a struggle.
Yeah. Yeah. And like I said, it's like like I said, we were talking about, when I was growing up, we went out after we finished our homework, we went out and played, and now it's like you sit in front of the TV or, like in just kind of this basic like eye contact, good voice, just, interesting conversation, but the other question I have is a lot of people listening to this, they're like, what's the difference between a counselor, a psychologist, and a psychiatrist? And how, like, if people are like, if their kid is wants guidance or struggling, because you do a lot of different things, how can they make that decision?
I get that question all the time. And so the way that I make the distinction is I tell them, like, I'm the counselor. You come to me for the coping strategies and the support and all of those things. The psychologist is the person that's doing the testing, if there's tests that need to be done. And the psychiatrist is the person that prescribes the medication. And a lot of times that's confusing to people because they may get a referral and they come to me and they want, they're coming for medication. And I'm like, I don't prescribe medication. Or they're coming to me for testing, like I want to get my child tested for this, that, or the other. You're looking for a psychiatrist, a psychologist, if you're looking to get, whatever kind of academic testing, IQ testing, whatever. If you want to test for different things, I'm like, that's not what I do, kind of thing. And so sometimes there's that confusion, especially with kids when they're looking to maybe if there's special ed considerations and all of those kinds of things. It's like that's not what I do, even though I have a background as a SPED teacher and I can help you with interpreting the testing and all of that. I'm not the person that administers all the tests.
Yeah. Yeah, I love that. For example, because a lot of people come to you, either you're the entry for either their kid is struggling or they're having but you also help a lot of people excel, right? Like, like they're well adjusted, but you help them go to the next level. So talk about how a counselor doesn't really, because a lot of people are afraid to go to a counselor because they're like, oh, that labels me as deficient or I've got a problem. But actually, even the Tiger Woods and Michael Jordan, they had coaches too. So talk about how a counselor can help you excel and succeed, not just pull you out of your struggle.
Just everybody that's, like you said, that's struggling. It's just someone that maybe wants to elevate and get to the next level. So sometimes just helping you set those realistic, smart goals and help you set those short-term goals that's going to help you get to that long-term goal. So helping you just like put in those benchmarks and helping you lay out or outline how you're going to get to the next level. Like that's something that the counselor does as well, just support you in that. So I love that you made that distinction, because it's not all just about someone that's really struggling with depression or anxiety, but it may be even someone who's excelling but just doesn't know how to get to the next level. So help someone to help you process all of that.
Yeah. And so I love this conversation. And how can people contact you, follow you, find out more about the work that you do, and reach out to you?
So Dr. Gwen's Counselor Cafe, you can find me. That's my website, drgwenscounselorscafe.com is more of the consulting side of what I do. So going into schools or nonprofits or governmental agencies and teaching people about self-care around some of the different mental health issues and how to take care of themselves so that there's better work-life balance and just to mitigate burnout and stress and compassion fatigue, all of those things. And then I'm available on Instagram or Facebook, all of that at Dr. Gwen's Counselor Cafe. And then the counseling side of what I do for just the practice is Coastal Crossroads Counseling Solutions. And I'm located here in Savannah, Georgia.
I love that. And for all the audience, let's thank Dr. Gwen for coming on and this fantastic discussion. And be sure to give her a like and follow on all of her socials, and check out her work. All these links will be in the resources in the show notes. And with that, thanks so much for coming on to the podcast.
Thank you so very much for having me. I enjoyed it.